Hi, everybody. This is Dr. Stanley, and I'm back with a quick medication fact. And today we are going to talk about non-benzodiazepine anti-anxiety agents. Now, I am going to go over some specific ones that are mainly for anxiety, but it is important to note that we also treat anxiety with SSRIs, so be sure to watch the quick fact video on SSRIs. And we also use even sometimes blood pressure medications that can help, such as metoprolol, propranolol, to help with anxiety. So let's go ahead and get started on some that are specific to anxiety, though, and one of those is called buspirone or Buspar, and this is a wonderful medication. SSRIs, of course, may be the first line of treatment for anxiety, but Buspar is also really good. They're not sure how it works. Is it a serotonin receptor agonist? We have no idea, but it is pretty well tolerated. The side effects of Buspar are dizziness, headache, nausea, headache again, I don't know why I put that twice, nervousness, lightheadedness, excitement, and it is well tolerated and it is not a controlled substance. Now, for some reason, recently we have been seeing Buspar be abused, so I think it is becoming a little bit more controlled than it used to be, but not so much as like a benzodiazepine or as an opioid. You do take it daily, sometimes a couple of times a day. It just depends on how it's prescribed. And it takes several weeks for it to work. So this is one of the downsides of buspirone. But imagine if you have somebody that's coming in with a lot of anxiety, you might start them on a benzodiazepine to control the anxiety in the short term, and then also start Buspar at the same time, because after about 2 to 4 weeks, this starts to work to control the anxiety. So the benzodiazepine short term, moving on into the Buspar, and then you can wean off that benzodiazepine, which isn't good for long term because of the fact that that tolerance does develop and it takes more and more to do the same thing. So about the time the tolerance starts to develop, we're weaning it off to just have the Buspar. It is not recommended for individuals who have hepatic impairment or renal function impairment because this may lengthen the half-life of the medication and it's going to provide some toxicity then. So let's go ahead and talk about another one. This is frequently used. I do believe, I didn't put it on the slide, but I do believe that there's some QT prolongation that can occur with this because I've had patients before that we've held it on related to a long QT interval that's occurring, and we don't want to throw them into a fatal arrhythmia by doing anything that's going to add to that problem. But it is a wonderful alternative to benzodiazepine that works very quickly and can be given either orally or through an injection route. And it is great for treating those with substance use problems because unlike a benzodiazepine, it does not have tolerance that develops and it doesn't have a risk for addiction at all. It is kind of chemically equivalent to like a Benadryl, so it is an antihistamine. And other medications may include SSRIs, again, and anticonvulsants, but this Vistaril or hydroxyzine is commonly prescribed on psychiatric units because it's kind of like a wonderful emergency breakthrough to people who are experiencing a lot of anxiety. So those are all of our medications, and I told you this was going to be a very quick medication fact segment, but these are non-benzodiazepine anti-anxiety agents, including other medications like SSRIs and anticonvulsants, and even some antipsychotics, which will be covered in other medication fact series.